Knock, knock, knock. All right, hi Marie, my name is Sophia. I'm gonna be your nurse for today. I am washing my hands, I'm for any privacy. Are you comfortable today? Okay, so I'm going to be performing your heart and peripheral vascular assessment today. So I'm just gonna take a quick look at your wristband. Can you confirm your full name and date of birth?
Marie Tobia, November 16, 2002.
Okay. And do you know what month it is?
February.
And do you know where you are today?
Hospital.
And do you know what we're doing today?
Cardio assessment.
So patient is ANO times 4. She is not in any urgent signs of crisis, no dehydration or cyanosis. She, like I said, is ANO times 4, is well kept, has good posture and mobility, looks appropriate for her age. Do you have any known allergies? And if you had to rate your pain today on a scale of 0 being no pain and 10 being the highest, where would you say you're at?
0.
0. Okay, so I think we are about ready to begin our assessment. I'm going to be touching you today. Okay, so we're going to start with inspecting the anterior chest. We just want to remove that clip for me for later.
Oh yeah.
Okay. So we're inspecting the anterior part of the chest, looking at the rise and fall. She has slow, even respirations, and there's no visible deformities on her chest. So now we are going to inspect and palpate the landmarks on the chest. So a good mnemonic to remember this is all people enjoy Time magazine. So we're going to start at the aortic, which is on the right side, second intercostal space. And then we move to the pulmonic, and then Erb's point, and then tricuspid, and then she would lift her breast up, and the mitral would be down here, as well as the point of maximal impulse, and we'll be taking a pulse there later. So now we are going to begin to listen and auscultate. We're going to start at the same apical pulse. Apical and pulmonary have S2, and tricuspid and mitral are S1. So now I'm just going to take a listen. Just continue to breathe normally. And she has a strong heartbeat. And it's even. Okay, and I'm gonna have you lift your breast up for me. Okay, and I'm gonna do the same thing with the bell of the stethoscope. And this is to listen for any murmurs. Don't hear any. Okay, good. So now there were no abnormal sounds. Everything was even, nice and loud. You could hear the lub dub. So now we are going to listen to the apical pulse for a full minute. So that is right back at the mitral area, the PMI, at the apex of the heart. So she's going to lift up her breast again, and we're going to listen for a full minute. And her pulse was 76, which is a normal finding. Anything around 60 to 100 is normal, and we wouldn't suspect anything of that. So that is it for the heart. Now we are going to move on to the peripheral vascular system. So I'm going to inspect the carotid arteries one at a time. Just palpating for them first. My hands are a little cold, I'm gonna warm them up. I know how they get cold. All right. So now we are going to listen with the bell of our stethoscope. We are going to listen for any bruits. We're moving down. I did not hear any abnormal sounds. So now we are going to move on. We are going to check her arms. So we're just looking at the integrity of the skin. There's no scarring. I'm going to check the temperature. It is nice and warm and dry, and we're checking for any edemas. And then we are going to check the capillary refill in all the fingers. So they all return in less than 3 seconds. And the nails look clean. There's no deformities. So now we are going to inspect the brachial and radial pulses bilaterally. So I'm gonna have you just relax your arms like this. I'm gonna start with the brachial pulse. Just trying to feel for them. And I would rate her pulse a 2, which it is easy to palpate and can easily be obliterated. And then I'm going to palpate for the radial pulse. And these are also easy to palpate. So then we're gonna do the same thing on the lower extremities. Patient would be in a gown so you can see everything. But we're just assessing her skin, feeling the temperature, checking for any edemas. And then we are going to do the capillary refill in the toes. And they all return within 3 seconds, no visible scarring. So last, we are going to do 2 pulses in the feet, the dorsalis pedis and the posterior tibialis. So we're gonna start feeling near the ankles here, feeling for a pulse. You can go ahead and relax your knees for you. And they are easy to palpate. I would rate that a score of 2. And then same thing. These ones are really easy to find. I would rate that also a score of 2, and they can easily be obliterated. So that concludes our heart and PV assessment. There were no abnormal findings. Did you have anything else you wanted to go over today?
No, that was all. Thank
All right,
you.
thanks, you're all set.